Did you know that the very medications designed to help you might also harm your brain? It's a sobering thought that the pills we often take without a second thought could impact our most vital organ. Today, we delve into how some common medications might not only alleviate physical symptoms, but also pose risks to our cognitive health. Understanding these side effects is crucial, particularly those that affect our memory and concentration. Stay tuned as we uncover the top 10 common medications that could be silently affecting your brain health. Also, always remember to subscribe to be part of the family. First on our list are benzodiazepines, commonly prescribed for anxiety and insomnia. These medications, often referred to simply as benzos, are quite effective at calming the nerves and inducing sleep. But how do they achieve this? Benzodiazepines work by enhancing the effect of the neurotransmitter GABA in the brain, which in turn slows down brain activity. This slowing down can provide relief from anxiety and tension. However, the very mechanism that makes benzodiazepines effective can also lead to significant side effects, particularly affecting the brain's ability to function normally. Research indicates that prolonged use of these drugs is associated with memory impairment and cognitive decline. Studies have shown that individuals who use benzodiazepines long-term might experience difficulties in forming new memories, processing information, and performing cognitive tasks that require focus and attention. This raises a critical question about the balance between the benefits and risks of these drugs. While effective for anxiety, the cognitive cost of benzodiazepines can be high. Next, let's talk about anticholinergics, used in many over-the-counter remedies. Anticholinergics are a broad class of medications commonly found in treatments for allergies, the common cold, and even in some products to help with sleep. But what might be surprising is how they work. They block acetylcholine, a key neurotransmitter in the brain responsible for memory and alertness. While these drugs can offer relief from physical symptoms, their effect on the brain can be quite profound. In the short term, individuals might notice dry mouth and confusion. Over time, however, the stakes get higher. Research has shown that a high anticholinergic burden, which means taking these drugs frequently or in high doses, is linked to an increased risk of dementia. This is particularly concerning given their widespread use. Often, people take these medications without full awareness of their long-term effects on brain health. Common yet potentially dangerous anticholinergics are a class to watch out for. Statins, widely used to lower cholesterol, also make our list. These medications, prescribed to millions, are hailed for their ability to reduce heart disease risks by managing cholesterol levels effectively. However, beyond their cardiovascular benefits, there's a lesser-known narrative. Some individuals on statins have reported experiencing cognitive side effects. These can include memory lapses, forgetfulness, and confusion. Such symptoms might not be as widely recognized as muscle aches or fatigue, but they are equally concerning for those who experience them. Delving deeper, the relationship between cholesterol and brain health is intricate. Cholesterol is vital for neuron function and integrity. Thus, lowering cholesterol drastically with statins might interfere with these critical processes. This interference could potentially lead to the cognitive issues some users report. Research is ongoing, and while definitive answers are elusive, the anecdotes and studies suggest a cautious approach. Always consult with a healthcare provider to weigh the benefits and risks tailored to individual health profiles. The brain-cholesterol connection is complex, and so are the effects of statins. Turning our attention to opioids, prescribed for pain but not without risks. Opioids, a class of drugs commonly prescribed for their effective pain-relieving properties, have a darker side that is often overlooked. When used over a long period, opioids can significantly impact brain function, leading to memory loss and a decline in cognitive abilities. Research indicates that opioids work by binding to specific receptors in the brain and nervous system, which not only alleviates pain, but also triggers a series of changes in the brain's chemistry and architecture. These alterations can impair the brain's ability to create long-term memories and can reduce cognitive sharpness. Studies have shown that chronic opioid users often experience diminished attention span, slower problem-solving capabilities, and impaired judgment. The brain's plasticity, which allows it to adapt and learn new information, can be hindered, making it difficult for long-term users to perform tasks that require concentration and complex thought processes. Effective for pain, yet potentially detrimental to the brain, opioids require careful consideration. Sleeping pills are next. a common solution for sleep issues but not without caveats. Many turn to sleeping pills in the quest for a restful night, yet few are aware of the potential cognitive shadows these drugs cast, especially among the elderly. Medications like zolpidem, commonly known as Ambien and isoprene or Lunesta, are widely prescribed to combat insomnia. While they do provide that much-needed shut-eye, they're not without their downsides. Studies have shown that these medications can impair memory and other aspects of cognitive function. This is particularly concerning as they are often used by the elderly, a group already vulnerable to cognitive decline. The mechanism? These drugs depress the central nervous system, and in doing so, can make the brain less active, affecting how memories are formed and recalled. It's a delicate balance treating insomnia effectively while preserving precious brain health. Alternatives do exist, such as cognitive behavioral therapy for insomnia, which has shown promising results without the pharmacological side effects. Sleep is crucial, but so is choosing the right aid with minimal cognitive risks. Antidepressants are vital for many, yet they come with potential side effects. These medications are designed to correct chemical imbalances in the brain, primarily targeting neurotransmitters like serotonin and dopamine. However, altering the brain's chemistry is not without its challenges. Some individuals on antidepressants may experience cognitive side effects. This could manifest as foggy thinking or difficulty in recalling details. It's a phenomenon that might be subtle at first, but can become more apparent with long-term use. The reason behind this lies in how these drugs influence neurotransmitter levels, which are crucial for clear cognition and memory retention. It's important to note that these side effects are not universal. They vary greatly among different types of antidepressants and from person to person. This variability underscores the importance of close monitoring by healthcare providers. Adjustments to the type or dosage of medication can often mitigate these cognitive effects. Mental health is essential, but understanding your medication is just as critical. Anti-seizure drugs are crucial for controlling seizures. But what about the brain? For individuals with conditions like epilepsy, anti-seizure medications are a lifeline, ensuring that seizures are kept at bay. However, the impact of these drugs on the brain, particularly concerning cognitive functions, raises significant concerns. These medications, while effective in preventing seizures, can also cause side effects such as memory impairment and a noticeable reduction in cognitive speed. Delving deeper, certain anti-seizure drugs have been associated with a dampening of neural activity, which is essential for preventing seizures, but can also interfere with the normal processing of information. This interference can manifest as slower thought processes, difficulty in learning new information, and challenges in recalling past events. Moreover, long-term use of these medications may exacerbate these effects, making it crucial for healthcare providers to consider the cognitive health of their patients when prescribing these treatments. Controlling seizures while preserving cognitive functions is a delicate balance. Beta blockers, commonly prescribed for heart conditions, also affect the brain. These medications, integral in managing conditions like high blood pressure and arrhythmias, have a lesser-known side: their impact on cognitive functions. While beta blockers are lifesavers for many, they come with a caveat. Some individuals experience symptoms such as fatigue and memory lapses. This cognitive fog is not just anecdotal. Numerous studies have delved into these effects. Research indicates that beta blockers can inhibit the release of adrenaline, which not only calms the heart but may also dull the mind. This can lead to slower response times and difficulties in recalling recent events. It's crucial to understand the balance between benefits and potential side effects. For those on beta blockers, regular consultations with healthcare providers can help monitor these cognitive aspects. Adjustments in dosage or even a switch to different medication might be considered if cognitive symptoms persist. While protecting the heart, one must also consider the cognitive implications of beta blockers. NSAIDs are everyday pain relievers, but they're not free from brain health risks. Non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, are a staple in medicine cabinets around the world, trusted for their ability to reduce pain, inflammation, and fever. These medications include well-known names like ibuprofen and aspirin. While they're effective at soothing everything from headaches to arthritis, recent studies have raised concerns about their long-term effects on the brain. Research suggests that prolonged use of NSAIDs may be linked to an increased risk of cognitive decline. The hypothesis is that these drugs could potentially interfere with the normal functioning of brain cells and might even contribute to the development of conditions like Alzheimer's disease. It's believed that the anti-inflammatory properties, while beneficial in controlling physical symptoms, might disrupt important protective mechanisms in the brain. For those who rely on these medications regularly, it's vital to consider these findings. Consulting with healthcare providers about the duration and dosage of NSAID use could be a crucial step in balancing pain management with brain health. Pain relief is important, but so is safeguarding your cognitive health. Lastly, chemotherapy drugs, known for their role in cancer treatment, also pose risks to cognitive function. These powerful medications designed to target and kill cancer cells, unfortunately, can also affect healthy brain cells. This leads to what many refer to as chemobrain, a term used to describe the cognitive side effects of chemotherapy. Patients undergoing chemotherapy often report varying degrees of cognitive impairment. Common symptoms include difficulties with memory, problems focusing, and trouble with multitasking. These cognitive challenges can appear during treatment and may linger for months or even years after the completion of chemotherapy. The exact mechanisms causing chemobrain are not fully understood, but research suggests that the drugs may cause changes in brain chemistry, inflammation, or disruptions to nerve cells. This highlights the importance of ongoing research and development in creating treatments that are not only effective in battling cancer, but are also gentler on the brain. Fighting cancer while preserving brain health presents challenges that require careful management. We've explored a spectrum of medications, each with its own set of challenges for brain health. The key takeaway is the importance of being proactive about our health. Always discuss with healthcare providers the potential side effects of any medication. It's crucial to weigh the benefits against the risks. Your health is your wealth, and that includes your brain. Please make sure you subscribe to be part of the family as we share informative videos on this channel. Stay informed, stay safe, and take care of your mind as well as your body.